I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in.
Okay.
Hello, my loves. Welcome back to the Love and Science podcast. I am so excited for this conversation today. I have with me a friend and a colleague, Dr. Ruth Odoi, who is a board-certified internal medicine physician and also the founder of Oasis Women's Functional Medicine, where she helps women to take back their lives, right? You see a lot of themes between Love and Science and Oasis. Dr. Ruth founded Oasis Women's Functional Medicine to help high-achieving women heal from burnout, hormonal imbalance, and chronic fatigue by uncovering and addressing root causes. Her practice reflects her commitment to a more holistic, faith-aligned approach, one that prioritizes personalized care and sustainable healing for women navigating high-stress lives and chronic illnesses. And I will reaffirm that infertility is absolutely a chronic disease. ASRM recognizes it as such, and I just cannot wait to have a conversation about Love and Science, Oasis, and how Dr. Ruth Odoi's approach can help us all. Welcome, Dr. Ruth.
Thank you so much for having me. It's such an honor. I really appreciate this time together, and I'm looking forward to a wonderful conversation. And hello to your community. I'm so excited to be here.
Thank you so much. So I think it's fascinating what you're doing, and as I was, learning more about you and your practice, it really came up that you take a holistic approach to medicine and your patients. And I will say, I think that's what's largely missing from fertility care across the US. There are many, many very good doctors who also work in complicated systems, right? And I think things are so fast paced and communication sometimes gets fractured. And to just think about root causes and holistic care, I would love to know a little bit more about your practice, which blends, more traditional internal medicine and also functional medicine.
Yeah, so, as a busy physician myself, I realized that, the current, traditional setting really doesn't give us space or room to really discuss everything that's going on. And so it's always, I felt sometimes that we feel rushed in doctors' offices where we want to talk about everything. We want to find out what's going on. We don't just want a prescription. We just want to know what's causing it so I can work on it. And so that led me in that path. I started experiencing some burnout and fatigue myself, and my blood work and everything was completely normal. And so I had to, go through that personal journey myself and rediscover some holistic approaches, some root cause approaches to my own care. And that eventually led me to starting this practice, because I realized a lot of women, of my, busy professional life, it's just so needed. And so that's, it's part of my story and part of the stories of my friends and my colleagues, and I said, I want a space where women can come and feel heard and feel seen. And so when you come to my office, it's not, your typical doctor's office. I have a full wall of wallpaper. Everything is just comfortable, and I just want that sort of vibe. And so that's what I created with Oasis.
It's amazing. How long have you been in your current practice?
Since earlier this year is when I officially opened the doors, and I'm still working full time and making that transition. It's a constant tug and pull and trying to transition fully.
Yeah, I totally understand that. It's when you know what you're called to do, and how you're able to help people sometimes better outside of systems. I think you realize your true calling, right? So it's a transition. And I'm so excited that you exist for your patients. I remember that you had mentioned that you do see people with infertility in your practice. Can you tell me a little bit
Correct.
more about, when you see somebody who has infertility, and let's just say all the tests are normal. Let's just start there because I think that is like, gosh, just in every single person's head, my tests are normal, but I don't feel right. It's not working. What's wrong with me is sort of the question, right? And how do I fix it? How can
Correct.
I just move on from this? Like, how do you take your ninja skills of, your listening abilities, your clinical acumen, and how do you approach a patient of yours with infertility?
Yeah, so thank you for that question. So, with patients that or the women that come to me with infertility issue, I look at it from a very holistic view. Number one is stress. So, we know how stress impacts our HPA axis and how the production of cortisol influences our sex hormones. And, we don't typically measure levels of cortisol, or we don't even look at it in conventional medicine unless it's high or too low. And that's when it's in a disease state and we have like a diagnosis and we have a treatment. But what I find is a lot of women who are, with high stress jobs and they are juggling a lot of things, there is that imbalance of cortisol level. And then there is also nutritional deficiencies that are there that we don't typically test in conventional medicine. And so when someone comes in, I do a very detailed nutrient panel and I look at every nutrient level because, we try to eat healthy, but I also know that with our current agricultural practices that we are not getting all the nutrients that we need from our food, regardless of how healthy we try to eat. And so I look at that and determine if you need some supplements to get those nutrient levels up, because once there are some nutrient deficiency, whether mostly it's micronutrients and, trace elements and these things that we don't really pay attention to, I try to optimize all those things to get a woman's body completely, optimized for for birth, for getting pregnant, because we don't look at these things, we just look at the big picture, but I go deep and I have like a whole cortisol reset program where I have partnered with a holistic nutritionist. And so we really sit with you. We look at the foods that you are eating to make sure that it is supporting your cortisol levels and making sure that, all those things are adjusted. So we do a very detailed work with women, to the point that we even provide like shopping list for you that is really
Uh-huh.
personalized to you and your lifestyle, to make sure that you are not deficient in any nutrients. And we are testing, so we have numbers to actually say that, well, as much as you are eating healthy, you are deficient here and there. And one thing I like to also tell people is that most of our foods are fortified, but it's not fortified with the right nutrients, for instance. And so it's not very bioavailable. So you are eating these things thinking that I'm getting what I need, but it's not bioavailable. So your body is not using it as is needed. So something as simple as like vitamin D, um, I like to look at a level above 60, but in traditional medicine, we are looking at 20 to 30. But we know it needs to be optimized in, immune regulation, and it has a bigger role than just like bone and calcium metabolism. So I'm a biochem major, so I look at I just go very detailed and I'm very personal in terms of like every woman. You are not just like another patient, you are your own person.
That's fascinating. Are there any patterns that you see in people with infertility and different specific micronutrient deficiencies, or do you feel like it's all over the map?
So I have a woman who did a nutrient panel, and believe it or not, they were deficient in vitamin A.
Hmm.
Wild. And so we optimized the vitamin A, and her cortisol levels were also imbalanced. So we got her on the program, and she's about 5 weeks pregnant without any other intervention.
Really? That's
Yeah,
fascinating.
it's just wild. I don't know if it's like timing. It's just she had her IUD out and was trying to conceive since 2022
Wow.
and just wasn't happening. And she just didn't pursue other like advanced,
Sure.
going through someone like yourself. They just were like, well, if it comes, it comes. And they came in, we did the nutrient panel. Her cortisol was off. There were some nutrient deficiencies. Like I remember vitamin A, which I was like, how is that even possible? But that's we wouldn't have known unless we tested.
Yeah,
So, and
that's
then she was
fascinating.
deficient in some other B vitamins, which is fascinating because we are never taught that these things could be deficient because it's in everything, but it's not bioavailable. And so it's, unless you test, you won't really know.
Yeah, that's so interesting. And how do you get more bioavailable? I know this is like I probably learned this in medical school, maybe. I again, we don't learn that much in med school about these things, and I'm sure my listeners have questions too. How do you make the food more bioavailable?
So for some, it's you may need supplementation of the
Got it.
bioavailable form.
Sure.
And it's also understanding that, when you compare the like things like the trace elements that we had in the soil, like back in 1972, the amount of iron that you would get from a cup of spinach has significantly
Uh,
decreased. And
that's
so
interesting.
yeah, so you would have to eat 10 cups of spinach to get really the amount of iron that you would get back in 1972. These are like
Hmm.
all published data. And so, we look at, it's really linked to how our current agricultural practices are going. And so it's also about reading the labels, especially on the foods that have been fortified, to know, okay, is this the bioavailable form, or should I eat the actual food that has this particular nutrient that I'm looking for versus like, you know, um, in what's the word I'm looking for? Processed. So it's about
Yeah.
processed foods and of like trying as much as possible to avoid the processed foods because they are not going to be as bioavailable as eating the whole foods. Like, if you want a potato, eat a potato, rather than a potato processed in some form.
Right, right. That makes total sense. So I did not realize before this talk that the micronutrients were related to cortisol levels, and that makes total sense. I mean, this is one of the tenets of my practice is especially female physicians with our stressful jobs are running
Correct.
around trying to take care of all the patients, trying to take overnight call, do surgeries, like whatever it is, balance all the other demands, keep it all together. And then, the infertility journey, it really becomes at least a part-time job, if not a full-time job, at the fertility clinic every other day for ultrasounds and blood work. And, you don't know when your egg retrieval is going to be. So then you got to block that week. I mean, it just the level of hypervigilance that needs to happen, arguing with insurance companies and medication companies and third party. I mean, it's so, so, so complex. And so, any way that we can lower the cortisol levels for our patients, and you can do as much stress reduction as you want, but if the micronutrients and the diet is off, people always say, what should I eat, what should I eat? But I think, and I say, sure, like eat from the outside of the grocery store, not the middle, eat as many
Yeah.
fruits and veggies as possible. CoQ10 is a well-published supplement that helps with egg energy because the eggs need, their mitochondria need lots of energy to cause the cell divisions to happen correctly and those sorts of things. But to have the data of those micronutrients and trace elements, I think that's very powerful. And we as physicians, we love data, don't we?
Yes, and that's why I love holistic nutrition, and because you can sometimes measure these things. And a whole lot of us are deficient in magnesium.
Mm,
Like, and it's involved in about 300 different chemical reactions in our body. And I would
wow.
like to believe fertility is one of them.
Yeah.
But, when you go and you are getting a magnesium supplement, the messaging is, you need a particular magnesium that's actually bound to an amino acid for it to increase your level of magnesium in the serum. You don't want something bound to like a magnesium carbonate or magnesium, the most common one, magnesium citrate. It only
Uh-huh.
works in the gut. It does not go outside the gut. So you will get a good, bowel regimen from it, but it's not increasing your magnesium. And a whole lot of people are deficient in magnesium. We are mostly also deficient in vitamin D. A lot of us are, especially with our busy lives. You get in a car, well, you go from your bedroom, you get in a car, you
Yep.
drive to your office, you get in a car, you drive home. I mean, you work out, but how much sunlight are you getting in a day to
Right.
actually boost your vitamin D level to, so it's a whole lot of factors, and we have to measure and get numbers that are specific to you so that you know what you are doing.
Yeah, that makes total sense. So far, just sort of thinking, zooming out to the forest, I heard you say that stress, when you see somebody with infertility, you think about stress and cortisol. And you also think about micronutrients, trace elements, and diet. What else do you think about in this context, if anything else?
Um, Hormonal imbalances could be, and I think that the hormonal imbalances comes back to your HPA axis, and the cortisol and the stress. So I think if there is anything that needs to be really honed in on, it is stress management. And I teach all my patients box breathing, and it's something you can do that is you can do that anywhere. And I tell them 3 minutes, 3 times a day, box breathing, that will help regulate your stress like significantly.
Yeah. And can you describe that for people who may not know exactly what that is?
Okay, so box breathing is you inhale for 4 counts, and then you hold that inhalation for 4 counts, and then you exhale for 4 counts, and then you hold it for 4 counts. So you are making a box of your breath. Does that make sense? So you
Yeah.
inhale, and that's going up
Hold.
and then across, hold, yep, and
Yep.
down.
And you
Yeah.
said 3 minutes, 3 times a day.
Yes.
Okay. Can you be driving? I'm like thinking about my multitaskers out there. Can you be driving while you're doing it, or is it best if that's all you're focusing on?
Um, that's a good question. I just tell people, do it the first thing in the morning, and then
Uh-huh.
the last thing, before sleeping, and then find some time in the middle of your day to do it.
Yeah. And
So
it's interesting. Like I know there's data on that particular strategy, which I love data. I think that, I always tell my clients and my patients, just try it. And if it works for you, fantastic. If it doesn't work for you, then try something else. But a lot of this is figuring out what works for you specifically. And the more tools we have, the better, right? Um,
absolutely,
yeah.
absolutely,
And it's interesting, like I think
absolutely.
about your comment about the hormones, like we know that if somebody's trying to restore their, regular cycles, say they have PCOS or some other reason why they're not ovulating, that yes, the hormone balance is really important. I think a lot of my patients and clients say, well, I'm doing IVF, my hormone levels are super physiological. So what does stress have to do with that? But I think that if you think about cortisol levels counteracting so many other things in the body, right? In terms of like same
Correct.
thing as carrying extra weight. Like we know the medications will work better in a more optimal state. And so why not optimize everything we can? And it does become a catch 22 because the infertility journey is inherently stressful. And so it's like, well, how am I supposed to reduce my stress as this is stressful? And I mean, that's what I love helping people with is okay,
Gotcha.
a lot of the stress comes from our thoughts and our feelings. And, if you have a thought that you repeat over and over and over again, like it's not going to work this next time, or this is my last embryo. If this doesn't take, then I'm not going to be a mom. Like these are the thoughts that come up over and over again. And I learned this in coaching school. A thought that we repeat over and over again becomes a belief and oftentimes a limiting
Correct.
belief. And so I think, yes, there is stress. It's complicated to figure out how to get to all the appointments and all the things. But I think we need to really take a close look at the thoughts that we have inside of our heads and if they're serving us or not, because a lot of the stress comes from the thoughts that we're generating about our circumstance. And that is actually in our
Absolutely.
control, you know?
Absolutely, absolutely. And and I always one technique that has been helpful is always taught, pattern interrupting. Like, once you get sucked into the cycle, because a lot of the things that we think about actually never happen if you think about
True.
it.
So
We
true.
we catastrophize and none
Yeah.
of it happens. It just doesn't. And so, just that pattern interruption of thinking, well, okay, even just pinching yourself or just changing your body physiology in that moment will help to reset, and then you can pick another thought. And it's very challenging because I think, and I could be wrong, but at least 80% of our thoughts are repetitive and negative. And so
Yes.
overcoming that is very, and so you have to be intentional. I think it's about intentionality. Like if you think that you will automatically stop thinking that way, it may not work. You just have to be intentional, and every day, one more time, try it again. One more time. I was just listening to Ed Milet, and I think he recently came out with this new book, and he talks about his dad's philosophy of one more time, just like trying something one more time, like this, one more time, and just one more day, and just encouraging yourself in that way that, I'm only here today, and this one more time. One more
Yeah.
time, let me breathe.
Yeah.
One more time, let me try again.
Yeah, or even
And
like a slightly different thought. If I'm ruminating and I keep having the same thought over and over again, and I think there's no hope of stopping, can I just try one more time to find that secret trapdoor out of that rumination loop? One more
correct.
time. Can I try something even slightly different? Or like, what would Dr. Odoi say here? What would Coach Erica say, Dr. Bove? Like,
Say,
those sorts of things. Sometimes we can't get out of our own thoughts, but if we think, what would somebody else think about our situation? Somebody in my support group the other day said, I'm so much more compassionate with my friend who's going through infertility than I am with myself. Right. So
self,
sometimes
yes.
we actually have to get out of our own minds to have that perspective to then start to shift.
Absolutely. Like, what would I tell my friend if they were going through the same thought process? What would I say to them? And
Yeah.
just say that to yourself,
Exactly. It's
that
hard.
goes a long
It's
way.
like we have this magnetic field force of not to do this, right? But I think it's a learned skill, and I think it's one that makes all the difference. Yeah.
Absolutely. Absolutely.
Um well, I also wanted to ask you, what are your thoughts about the connection between gut health, adrenal fatigue, thyroid issues, and burnout? I remember you sort of connected all those in one sentence when we spoke before. And I feel like I know very minimal information about gut health, truly. I know I've listened to some of your content, like you are very much an expert on gut health. So how do these things tie together and how might they be relevant for somebody with infertility?
Yeah, so I think having a healthy gut in general is a good baseline for an overall, health and vitality. Why? Because our gut has a difficult job of trying to keep out bad guys. So we have the junctions, just I'm not trying to bring you back to physiology or pathology, but
We love
you have
physiology
those
on this
cells.
podcast, so just carry on.
So remember those cell junctions that, sit between the
Yeah.
epithelium, like the lining of our gut. They have a difficult job of trying to keep things out, but also trying to absorb the nutrients that we need. And a lot of times, things like stress will release some interleukins that increases the permeability of the gut lining, And once that's happening, then you are having trouble absorbing food. And then another thing that's happening is the disruption of our gut flora, whether it's through antibiotics or even stress
Mm-hmm.
or changes in the environment in the gut can change the gut flora. And that all can lead to dysbiosis, and, all that ties back into stress and our mental health, because 80% of the serotonin that we use is made in our gut
Mm-hmm.
through the production of tryptophan. And that's the making of serotonin, which is a calming neurotransmitter. And so when the gut flora isn't stable, we run into dysbiosis and serotonin deficiency, if you will. So there is that. And then there is also the fact that there is a lot of toxins that our liver is constantly trying to um, break down in terms of like the phase 1 and phase 2. And so when you look at a hormone such as estrogen, it goes through the liver in terms of conjugation and just
Mm-hmm.
trying to detox out of your body. And so when your liver is sort of overloaded with toxins, I know this is like functional medicine talk, and once that's happening, then you will have trouble with estrogen, because now it's not being properly metabolized through your body.
Oh,
And so there
interesting.
is, yeah, so there's, and so, when I think of that, I'm thinking of women who are in perimenopause who come to me and they need like hormone replacement therapy. And I share with them that, listen, if we don't do a detox or a gut detox, I can give you all the estrogen or I can give you all the support, but it's
Mm-hmm.
not going to go anywhere, because there is like phase 1 needs to happen and phase 2 needs to happen, and the metabolites need to leave your body. But when there is an overload and it's not happening, I'm just adding to the toxin load. And this is
That's
not
really
something,
interesting.
yeah,
Go
this
ahead.
is not something I learned in medical school. So, when you think of the liver, you're only thinking of, do you have elevated LFTs or not? That's how I have learned about the liver in medical school, but there is so much more to it. So when I'm thinking gut health, I'm thinking of the liver, and I'm thinking of the small intestines, especially, and the large intestines, um and all the different things that kind of affect it. I hope I answered the question. I
Yeah, no, and I
just
was
feel like
thinking
I'm
about it. So I think that there's been some links between the gut microbiome and the, uterine microbiome, which is interesting, just to think about those connections there. So if we improve our gut health, that it is highly likely that we'll be improving our uterine health, and I
absolutely
think I need to read more about that, but I've the preliminary data that I've read would suggest that exactly. So that's really interesting. And then also your comment about estrogen absorption is really relevant, because so many people, say you have frozen embryos and then you need to do a frozen embryo transfer. One of our mainstays of treatment protocols is to give estradiol, right? To give 17 beta
okay. Yeah.
estradiol for the lining to thicken. And we have a pretty large subset of patients who do not mount a uterine lining to the estrogen. And it's like, what is going on there? I mean, this is the bane of our existence as fertility specialists. You have these beautiful embryos, but you don't have the soil, so to speak, to put them in, because the lining doesn't get thick. And maybe it's a metabolite. Say, oh, they just don't metabolize estrogen the same way, or their receptors or something. But I think, what if we could take a more holistic approach and think about
Correct.
a gut detox, and maybe that will actually help your liver to not be so hard on this estrogen that you're trying to metabolize, and maybe you're going to have more bioavailability if we can think about the whole picture. This is fascinating to me. So and hey, if something is not working over and over and over again, why not try something new? I mean, the risk benefit of a gut detox sounds pretty, in favor of benefit from my perspective.
Exactly. And I think that when people hear the word gut detox, they just associate it with like some influencer on, Instagram or TikTok, but like there are protocols that we follow as like holistic practitioners or holistic physicians that we do it. It needs to be done under the guidance of an expert. I don't
Mhm.
think you should go and get a gallon of whatever online and just drink it because it says gut detox. I don't think that's the
Mm-mm.
right way to do it.
Sounds
I think
dangerous.
that,
Yeah.
yeah, it can be done in a very controlled and evidence-based manner. And so, most women who come to me, I do put them on a probiotic because by the time you are 20, I don't know how many times you've taken antibiotics, for
Yes, yes.
ear infection.
And our patients take them with high frequency because I'm like, oh, you have chronic endometritis. You need to clear that. So here's more doxy, here's augmentin, here's ciproflagyl. And I'm
Correct.
thinking, my clients tell me they're on ciproflagyl, and I'm like, I hope you don't get C. diff. Like, just like, oh my
Yeah,
goodness.
yeah,
But I
yeah.
think our people more than others actually are on a lot of antibiotics, and we try to be good stewards as fertility specialists. But sometimes you treat one problem and you create another, right?
Absolutely. And
Yeah.
and things something as simple as a PPI can also disrupt your gut flora because once you
Yeah.
change the acidity in the stomach,
Mm-hmm. That's
now
right.
the resident flora in the stomach are not so welcome. So it's going to change over the gut, that flora in that stomach.
Mm-hmm. It's
Um,
interesting. I'm just thinking about my own practice here. It's like fascinating. I've sort of been toying with when I give somebody antibiotics for chronic endometritis, what if I just automatically put them on a vaginal probiotic? Like just to say, like, you need good bacteria, you need L. crispata. We know this from the data. Like that's one of the ones you need the
yeah,
most. And so, I feel like I do treat people with antibiotics, and then we do a tested cure. Great. They're infection, inflammation's cured. Go on, have your transfer. But I think the more responsible thing to do with this information, not that it was irresponsible before, with knowledge comes power, is that we could
yeah.
potentially just be very proactive about the flora and the microbiome in that way. So thank you for that. I think I'm going to change my practice based on that.
Oh, well, thank you.
Yeah.
Absolutely. I
Yeah.
think just helping them with the probiotic and changing that flora could make a difference. It could make it
Yeah.
because they are there for a reason. So
That's right. They are there for a reason. That's right. Um, I have another question that is tangentially related, and I know you do a lot of work with chronic fatigue, people with chronic fatigue.
correct. Yes.
And this is a question, it's burning, so please answer it how you want to. But my question is, why are we all so tired? Why are we all so tired?
Well, let's
And I mean, my patients and my clients have infertility and all these things, but like I feel like that is the most common and non-specific sort of, you know, comment. And I experience it at times myself. And it's like, what can we do to help the chronic fatigue as people? We know eggs need energy. We know embryos need energy. We
correct.
know sperm need energy. So, why are we so tired, and what can we do about it to make ourselves start to feel better? I know it's a big question, but I know this is your jam.
Yes. So the first thing I say is like, as Americans, we are well fed, but undernourished.
Mm-hmm. Yeah.
So that takes me back to the soil that we are eating from, from our plants. Are we getting enough trace elements from the foods that we are eating? Are we getting enough nutrients from these foods? Because all at the end of the day, when your body is not getting the micronutrients or the trace elements or the nutrients that it needs, it's going to take it from somewhere. And so you get depleted. And I think that's the first reason we are also tired is nutrient deficiency. And when we think of nutrient deficiencies, we don't count ourselves as like part of it because we are in a very developed nation in the world. But our foods that we eat are really not, and I think there is coming a time where they are going to start changing the agricultural practices and they are going to start changing the types of things that they put in our foods. In terms, when I say they, I'm not trying to start a a conspiracy or anything, but the foods that we eat aren't healthy.
Mm-hmm.
That's they are not nourishing us. And there needs to be a shift, in terms of when you look at a typical food label and you read what's in the food label, there are a lot of inflammatory substances that we are eating, and it's labeled as healthy, but is it healthy, and so I'm going about, but the first thing is really to take a deep look into what we are putting in our bodies. I think that's why we are tired. Another reason is our circadian rhythms have all been disrupted because of our lifestyle. So, what do we do before we go to bed? We stare at our phones. The blue light is not helping, the brain to release the melatonin that you need that's supposed to put you to sleep. It is not. And so you are getting, you're not, you are getting the blue light, you're not sleeping well. And so your circadian rhythm is off, and that affects a lot of systems in our body, including the HPA axis, because cortisol is released in a very diurnal fashion, and it's really dependent on the circadian rhythms that we have. And so when that's disrupted, it's going to disrupt things.
That
So
makes
those
total
are the
sense.
two things that I really try to impress on the women, that listen, what you eat is 80% of the battle,
Mm-hmm.
really.
Interesting.
It's
And I think, my clients, I'll speak about my clients because that's a very particular niche. I think that there's
yeah,
this hyper focus of like, am I doing all the things right? Right. Because it's like high achieving women, mostly physicians, like they're spending lots of time and energy and effort on their diets because, they're like, oh, I need to go anti inflammatory. I need to cut out gluten. I need to cut out dairy. And I'm not even, I don't even have celiac, but this is what I've read online. And I think that focus is very well meaning, and of course we want to do all the things to optimize outcomes, but then I think it takes on this like extra level of stress and hypervigilance, and I wonder if it's not counterproductive in some form. And right, so I think, how wonderful would it be to have somebody like you who could just like, not just, who could run the tests and say, this is your profile, this is my prescription for you, here is your shopping list. Like I say in the fertility world, I'm taking the burden from you so you do not have to worry. Like, let me
correct.
take this, nutritional burden from you so you do not need to stress, and we can support you through this journey.
Absolutely. And that's
Yeah,
what I do with the cortisol reset program, because I realize people are busy. No one has the time to be reading food labels. It's just tough,
it is
So
hard.
what do you like to eat? These are your nutrient deficiencies. We've tested it based on your own blood sample, and this is where we are. And what do you like to eat? How can we embellish what you already like to eat so that you can get all the things that you need to get you feeling great? Because at the end of the day, if you are not feeling great or you feel tired, it's really going to affect everything that you do,
Mm-hmm.
including your resilience through the process. And so I try to take off that heavy load. And the we work with a holistic nutritionist, so we are looking at things at a very holistic and science-based level, really.
Sounds a lot like love and science. I
Yes.
think we
and
have a lot of
and
parallels.
yeah, and I want to make a comment about the thing with dairy, that I know dairy can be inflammatory for some people, but I want to encourage the women, that if you are going to not eat dairy, realize that it may cause some vitamin D and calcium issue. And so you
Yeah.
have to make a plan about how you are going to replace that,
Mm-hmm.
so that you are not in an attempt to prevent one thing, create another problem,
That's a really good point.
so
Yeah. And we know like
yeah,
osteoporosis is such an issue. And,
correct.
we don't just want to focus on this chapter of life. We want to focus on the whole picture.
Absolutely, absolutely,
Yeah.
absolutely, absolutely.
This is so fascinating. I also wanted to ask you, you mentioned that your practice is faith-based, and I wanted to ask, what do you see, like, how does that enhance your practice to be open to that wisdom, those frameworks? Like, tell me about the role of faith in your medical practice.
Yeah, okay. So, um, they've done some studies where, with, and this was done in cancer patients, so I know it may not, you know, be comparable to your audience, but we do know that people who cultivate hope or who have hope tend to do better than the people who don't have hope. And so what we see is people who practice any religion or believe in a higher, a power higher than them tend to have increased hope. And that hope can make all the difference. We've seen it make a difference in cancer patients where when they had hope, they were more likely to respond to chemotherapy versus those who did not have any hope. And so, and then we also see that social connectivity makes a big difference in our overall health. So what do people who go to the mosque or go to to church or go to a temple have in common? There's that social network and that connectivity and that togetherness that is so powerful that I know when I go to church on a Sunday, I go feeling one way and I come out feeling more hopeful and more positive. And so it's so strong that there's that element there that um so spirituality and believing there's a higher power can make all the difference in your health and well-being.
Yeah.
And
Yeah.
there are a
And
lot of studies.
I think that's true. And I mean, I will tell you, there are many times when I go into a transfer room for an embryo transfer, and I can just tell somebody's very shut down, very, just without hope, hopeless, really. And, a lot of times I'll take a moment and I'll say, like, let's just take a moment and breathe or pray or whatever it is. Like, I want to get you into a better headspace for this transfer because I've been doing this over a decade. I will tell you, the people who have the authentic hope is what I call it, that the transfer is going to work, they have higher success rates. And I wish that was the whole story. Because if I could just say just cultivate hope and you're going to like, your transfer is going to work. I mean, it takes more than hope. However, it's, what do we say? It's like, it's one of those things where if you don't have it, it's not a good thing. Right. And so what we're
Correct.
looking for in my field is uterine receptivity at the cellular level. We need there to be alignment so that an embryo is placed in the right spot and that little embryo can find a home. And so, I always say to my clients, and I say most of my clients do believe in a higher power because they seek me out. And that is me. I'm very much about getting grounded, about, trusting a higher plan, about connecting with other people and that flow that can happen between us when we allow for something greater than ourselves. I think it's really powerful. And I don't believe, I don't believe this, like these like pithy statements, like everything happens for a reason. And that, like, I think sometimes
Yeah.
this can be used against people. And there's this whole thing
Mm-hmm.
about spiritual bypassing that I think is actually very dangerous. Because it's like, no, we need to have it in the messy middle, right? We need to have it alongside
Correct.
us, keeping us going, keeping us committed, keeping us authentic. Hope by definition means that we take science into the equation and find scientific reasons to stay hopeful. And so I'm a very much a believer in hope, but like the right kind of hope, right? And
Absolutely.
I think you're right. I think that when we can take a, more positive, and I think just open, like a more open, can do, possibility thinking stance on our health, both in terms of chronic disease and including infertility, I do see better outcomes. And I also think people stick with treatments longer and give them a greater chance to work because mentally it's I don't want to say it's easier because it's not easy, but it's more doable to stay in the game.
Absolutely. And one thing too we know is that when you go in this like to social gatherings for religious purposes, whether it's the temple or church or whatever, and you sing, it's a vagal nerve
Oh, interesting.
reset singing.
Huh.
And so just singing can reduce, it can shift you from from the sympathetic to the parasympathetic, just
Oh, that's
singing.
fascinating. Huh.
And what we do in these gatherings, we do a lot of singing, whether so there's so much connections there, and I could go on and
Yeah, that's really interesting. I do love to sing, and I do love to sing at church. I also love to sing on my treadmill.
yeah, and like you can even think about like a football stadium full of like men just singing together, and that sort of bond it creates.
Yeah,
It's like such a wild release of oxytocin, which is so good for your body, just
so
like
good.
having that togetherness and singing and believing that one thing, whether it's football or God, it makes all the difference.
Yeah, I think you're so right. And one thing we didn't exactly talk about directly, but I've heard you talk about before is the neurotransmitters. And by this, increasing our vagal tone and improving the neurotransmitters, which are good for our brains, and tamping down the ones that are not so good for our brains and the rest of our body, right? That it helps us to
Yeah,
feel better. And I think that, if we're in a storm of cortisol, epinephrine, norepinephrine, all those things like that, those sympathetic hormones, we're going to feel hypervigilant. We're going to feel on edge. We know it's not good for our health. We don't lose weight at the same rate. Like there's all these things, right? But then it's not just about
correct,
reducing those, it's about encouraging the other ones, right? With mindfulness and
correct,
singing and connectivity and hope that oxytocin, dopamine, there's serotonin, there's so many good ones. It's like, sure, we have all these mood stabilizing medicines, but what if we actually looked at things that we can do outside of these medications that also, in gratitude's one. I talk a lot about gratitude where
absolutely.
we know that it increases our neurochemical soup of the hormones that help us out in a beneficial way. So let's seek out those opportunities in this holistic approach so we can not just feel better but have the best possible outcomes.
Absolutely, absolutely. And one simple, or maybe not simple, but if you're a hugger,
Yeah.
hugging someone that you love for 20 seconds increases oxytocin, and it decreases your heart rate. And it just does a lot of goodness to your body that can be helpful during the infertility journey. So
Yeah. And that's free. A hug is
it's free.
free.
Yep.
I hope that every single one of us has at least one person in our life who we can hug for 20 seconds, right? Yeah.
Yes.
Yeah. I wonder if it applies to pets too. Especially at Love and Science, we have a lot of people who are very, very amazing dog moms. And sometimes we share pictures of the dogs. I actually, sometimes seeing children can be quite triggering for my clients and my patients. And so I say, when
Yeah.
you see a pregnant woman or you see a child, go find a dog, go find a dog and just focus on the dog.
And
But
hug the
anyway,
dog. Dogs are harmless. Yes, I
hug the
love
dog, right?
dogs.
Hug the dog, let it
Hug
let,
the
let it love
dog.
on you.
Yeah,
Oh my goodness.
yeah.
Um, well, this has been so amazing. I wanted to sort of ask if there's anything else you wanted our listeners to know. Obviously, tell us where to find you and all those things, but is there anything else that you feel needs to be said with our conversation today?
Yes. So one thing we didn't touch on is the use of omega-3
Mm-hmm.
supplementation in terms of helping with inflammation, because and the cell wall is made of omega-3, omega-6, omega-3 being anti-inflammatory, omega-6 being pro-inflammatory, and we have a lot of omega-6 in terms of our diet and the oils. And so if there is one thing I would say that I believe we should all take is a good omega-3 supplement, a vitamin D supplement, and a good magnesium supplement. I think those, and a probiotic, I think those four can make all the difference.
There's use of vitamin D, omega-3, probiotic, and magnesium. and the
Correct.
right kind of magnesium, if I heard you correctly there.
Correct.
Okay.
Yes. 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 Yes.
Okay.
I think I have something on my website about supplements, and I go into details about the types of magnesium and what to look for on a supplement label,
Oh, that's
to make
helpful.
sure it's been third party tested.
Yeah.
So it's not filled with fillers and all other stuff that you don't need.
Well, it's interesting. I have a friend who's very into, she's a Reiki master and she's not a physician. She is absolutely brilliant. She's a therapist. And I mean, she just does all this holistic healing. Right. And I spent the night at her house a couple of weeks ago because we were going to our college reunion together. And she was like, "Oh, would you like some magnesium? It'll help you feel relaxed. It'll help you sleep better." And it was something I just had never considered. Right. And I was like, "Oh, sure. I'll take some magnesium." And so truly, like, she gave me some magnesium and I took it and I was like, it was almost like the resting tone of my body change. Like it
Yes.
was almost like I had this wave over my body of just this relaxation. It's hard to describe. And I was like, she's right. I
Yeah.
do feel more calm, and it just seems
Yeah.
so simple. And so, I've never had my magnesium tested. Maybe Dr. Odoi, you should be my doctor. Maybe we'll talk later. So we can really get some
Yeah.
numbers on this. But I was like, well, that's really interesting. If like, and I know there's placebo effect and everything, but I try to be open to like, well, what if it's real? Right. Like I felt so much better even after one dose of magnesium before bed. And I was like, well, maybe there's something to this. And people with headaches, and I could go on and on, like that's safe in pregnancy, whereas other things aren't. And I think you have a lot to offer, and I think that we need more of what you bring to the table in terms of holistic healing for all of us, and also specifically people with infertility, for sure. So
Yeah. Thank you. Thank
thank
you.
you.
I
So
love
where
what
can
I
we find
do.
you? Yeah, I know. I can tell you love what you do. I can tell. Where can we find you?
I am I'm on Facebook, so Oasis, OASIS, Women's Functional Medicine. I'm on Facebook. I'm also on Instagram, and my website is www.oasisfunctionalmedicine.com. So yeah, I'm on all those places, and yeah,
Where do you have licenses?
I have license in New York and Ohio.
I'm in New York. Woo woo. It's happening.
Woo!
Oh my goodness, Dr. Odoi, thank you so much for joining us today. This was such a pleasure, and I cannot wait for our listeners to benefit from this conversation.
Absolutely. Thank you so much for having me, and um I enjoyed my time here.
Likewise. Until the next time, my friend.
Yeah.
Bye.
Bye.
Thank you for listening to the Love and Science podcast. I'm so glad you joined us today. If you found this conversation valuable, if you could please rate, review, and share this podcast with your trusted people, it would mean so much to me. If you want more tools to help you navigate the fertility journey, please book a discovery call with me today. The link is in the show notes. Please do not let infertility have the final word. I'm here to take the burden from you so that you can achieve your goal of building your family. In gratitude, this is Dr. Erica Bove. I'm rooting for you always.